Hi, I'm Dr. Christina Chester, and welcome again to our MCPS video series, Waymaking. Our goal is to help families make their way through many of the emotional challenges we are faced with today. I have with me today Ms. Kimberly Townsend, RN, who is a senior administrator for the Montgomery County Department of Health and Human Services in their Communicable Disease and Epidemiology Department, and Dr. Patricia Kapunan, pediatrician and the school system medical officer. Thank you for joining us today.
Thank you for having us.
It's a pleasure to be here, Dr. Chester.
So for my first question, so there is a lot of information in the media about a new illness in the community called Monkey Pox or MPX. Can you share with our audience what MPX is?
Absolutely. MPX is a rare disease caused by a virus. There's a lot of information in the media about this, probably because it is rare, and we don't usually see it in our community. So it's not a new virus. It's something that we've known about, but we haven't seen very often. The cases that we're seeing now have been largely in adults and rarely result in hospitalization or death. The virus causes a characteristic rash, which helps identify if a person has the infection. And before the rash appears, a person may have mild flu-like symptoms.
No, thank you for that information. And then it's good to hear, what you've shared with us around that. And so then my next question is, so, I mean, we hear that, you said the symptoms and so forth are mild. And so on what's been seen so far, and we've been seeing this primarily in adults. And so, but then one of the questions from our community has been, so how is MPX spread and how can it be prevented?
Well, that's a great question. We're learning more about MPX and how it is spread every day. We know that it can be spread when someone has skin-to-skin contact or shares personal items with someone that's sick with MPX. Based on what we already know about MPX, there are some things we can do to help prevent the spread of this and other illnesses as well. We can all work together to stay healthy as a community. We want to remind everyone to observe some basic hygiene measures, such as washing your hands, especially before you eat or drink or touch your face. It is also helpful to prevent the spread of germs when we avoid sharing personal items with others, such as cups, eating utensils, and towels. If you feel sick, we encourage you to stay home and rest, and to also let your doctor know if you do not feel better. It also helps to avoid others that are not feeling well.
If you are concerned about a rash, especially one with red bumps that are changing over time, painful or itchy, I would recommend getting it checked out. An important point about MPX is that it spreads much less easily than COVID. So many of the strategies that we already use to prevent spread, like cleaning, disinfection, that we use for COVID are effective for MPX.
No, and we definitely, as you all shared, need to be mindful of our spaces and just, us being around others. And so like we've been doing. And so, and the sharing of things, like I tell that to my kids all the time, right? Like, okay, so don't go eating off of Susie's plate or don't drink out of Johnny's water bottle. Like you brought your own stuff for a reason. So, all those things are just there to help us, to be mindful in the spread of all illnesses that are out there. And so is there anything that our staff, students, and families that they need to be aware of?
Well, we'd like you to know that our public health services team members communicate regularly with other public health experts and your school administrators about new information and ways to stay healthy. As we learn new information about MPX, we can share that with you. The Public Health Services team is working very hard to provide information to our community and to help slow the spread of MPX.
And speaking from the school perspective, we are really thankful to be able to work closely with our public health colleagues on this. Since schools themselves are low risk for transmission, unlike COVID, things like diagnosis, testing, contact tracing for MPX, all of that occurs outside our walls, but we still want to be prepared to do what we can to reduce transmission and to support our community.
No, absolutely. And so for my last question, do you have any suggestions or feedback for families and students to help them to stay resilient during this time?
Sure, we know that some may be fearful of going out and about among their daily activities, such as taking the bus and shopping and other things that they may enjoy. There are people in your school and the public health services team and in the community that you can talk to when you have concerns. We are all here to help you. And on that note, wishing you all a very happy and healthy school year.
No, thank you for that. And so, as we wrap up, I want to thank you, Kimberly and Patricia, for your time to be with us today. And we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on the show, please visit the link on your screen. Also, please go to our YouTube playlist to find additional shows in our series. And please join us next time on MCPS Waymaking.